if we would talk about toothbrushing and basic hygiene, Dr. Pauling, explain a little bit. And we all know it's important. We all learned in school. Everybody learns it, but still, are we brushing oval? Are we brushing up and down? Are we brushing this? Soft toothbrush, electric toothbrush, hard toothbrush. Just take us through again. And one question I really want to also get answered is, why is it that some people need a cleaning every 2 to 3 months and other ones only every 6 months in the hygiene level? And regardless of how well they brush, they still need a cleaning every few months rather than every 6 months. And some people literally, with not all that much brushing, could potentially go a year and no real big deal. That whole package, tell us a little bit about it.
Okay, that's kind of a lot to dive into, but
it's a mouthful. It's a mouthful,
Yeah. So I think we all do know the basics of brushing. To brush in small circles, 45 degrees towards the gum line, all your teeth, front and back, and on the biting surfaces. And I think a big thing is a lot of people today have gravitated to the brushing twice a day, which, that is kind of a bare minimum that we want you to do is to brush twice a day. And so when people think, okay, that's what we have to do is brush twice a day, they kind of start to think, well, if I miss in the morning some days, it's all right. The 2 is kind of the bare minimum that we want you to do. Still, the gold standard would be to brush after every meal or every time you eat. So that's what people should aim to do, and make sure you're flossing.
I'm a big snacker. That's impossible because I'll be running around with a toothbrush more than I do anything else.
Well, I understand that it's not the easiest thing to do, but if you're one of those people that we talked about that might fit into, having to come in every 3 months for cleaning, you're probably one of those people who should be brushing after every time you eat, or at least after your big meals in the day. And the reason for that is that some people are at higher risks for different things, just like in your health. Some people are just at a higher risk of high blood pressure than other people. Just genetics. A lot of what happens with our bodies, with our mouths, is based on certain bugs, and some people are unlucky to have bugs that are a little harsher on their mouth. And the purpose of having a dental cleaning, and what our cleaning does for you, is it removes deposits that your toothbrush at home can't get rid of. And some people build up tartar and things like that faster than others. And if you've had any history of gum disease, we talked about in some other videos about how bad gum disease is. They're generally the patients that we see more regularly to try to get rid of the gum disease or keep it under control as much as possible. And another thing that I think is really important is the toothpaste and the toothbrush. I think people know now that you can't use a hard bristle toothbrush. That's rough on your teeth. And so what the people who make toothbrushes have done is they're very soft and they're medium. So they started to call the hard bristles medium, so that patients will still buy those. We don't want you. I still hear patients say that it just doesn't feel the same when I use those soft bristle toothbrushes, but it's really the best thing for your teeth not to use them. And toothpaste can also have a big effect on wearing away your healthy tooth structure. Whitening toothpaste generally is not very successful in terms of whitening the teeth, and it's generally more abrasive to your teeth. That's what they do to make it, make your teeth look whiter. So they make it more abrasive to get the stuff off your teeth, and that can also wear away on healthy tooth structure. So those are the kind of things that I'm kind of like to warn patients about. Is the toothpaste can be just as bad as the stiffness of your toothbrush.
Right, makes sense. I mean, obviously, as more, chemically strong it is, it kind of like, has a potential of ruining it. Now, let me ask you, what about electric toothbrush? Are they really a God's given gift? Are they really that much better, or is it not really all that big of a deal?
The thing about the electric toothbrush is that it's wonderful for patients who have kind of lost manual dexterity. It's really great for elderly patients who just can't do it quite as good as they used to. Mm-hmm. It's great for kids who are wearing braces and just can't get the same kind of cleaning from a traditional toothbrush. And if a person brushes their teeth properly with a manual toothbrush, they'll get, comparable results to what they'll get with an electric toothbrush. The problem is that, we just don't have time and attention to brush the teeth the way we're supposed to with a manual toothbrush. The advantage for the average patient is that it kind of takes some of the thinking out of toothbrushing that they should be doing that they might not be doing. And, you just kind of have to run it around where it's supposed to go instead of, being meticulous about how you're brushing, and you can get better results that way.
Right. Okay. All right. So let me ask you this: in terms of flossing, for instance, any some such advice in flossing, different floss, not floss, or any mistake as patients make continuously, even though yes we floss but we do it wrong? Is there any advice you have in that area?
The main thing with flossing is people don't do it enough. I think everybody knows they should floss, and they should be flossing once a day. In terms of what floss to use, if you find you like one kind of floss better than another, use it, because we just want you to use some sort of floss. And in terms of technique, a lot of people will just kind of pop the floss up and down through their contacts. The best thing for flossing is after you get through the contact of your teeth to slide it all the way down, kind of under the gum line against one tooth and again against the other tooth before bringing it out. Those are kind of the basics of flossing, and do it more often.
And do it more often. Okay, so you do want the person to kind of rub the gum line a little bit in order to, move away whatever little infection might be sitting on there or something like that, I guess, right?
That's right. It cleans the tooth as far down as the floss will go, and it kind of stimulates your gums to clear away anything that they can on naturally.
Right. Now, I have lived a couple of years in India, and almost everybody there used a tongue scraper. And I used one for a while, and then I, kind of came back and I gave it up. And I do, however, brush my tongue, and even though it makes me gag every morning and or at night, so I do brush it. Any comments on that? Is a tongue scraper better? Is brushing just as good, or is neither one of them needed? Maybe am I doing something which really has no impact at all?
So the reason why tongue scrapers kind of came to be is they did studies on halitosis, or on bad breath, and they tried all kinds of different products like mouthwashes and pills and all kinds of different things, and the thing that had the best results for improving bad breath was the tongue scraper. But my experience is that a toothbrush is just as good or maybe even better than the scraper at cleaning your tongue and reducing the amount of bacteria that's there and on reducing bad breath. So the toothbrush is fine. The scrapers work too, but it's just a lot easier to go ahead while you're brushing your teeth to get the brush on your tongue as well.
Got it. So, but it is something one should do. Brush one's tongue.
Yes. For those reasons that I mentioned, to reduce the bacteria amount in your mouth and to improve your breath.
All right. Here we have it. A kind of a rehab on what we learned in kindergarten on how to brush teeth. Thank you very much.
A little more advanced.
A little more, absolutely. You know what I mean? Thank you.